Hi, hello, assalamualaikum. My name is Shaz and this is Farah. We're both clinical psychologists from WeCare, a Light Health Center and Mental Health venue. So today for our COVID-19 series, we're going to talk about managing distress in children. Okay, so once again, COVID-19 just does not only affect adults but it also affects children.
Yep, definitely.
Yeah.
Sometimes we don't realize that whatever us parents or older generation feels, our kids are actually feeling it too. They are actually receptive to adults, and it's just that sometimes we forget because we're worrying. We forget that they worry too. Because the thing is, it's not just you who actually have to adjust. It's them as well. For example, they can't go to school and meet their friends. They cannot go out to the shopping mall and get that favorite ice cream. Kan, Shaz?
Yeah, and for those children who actually understand a little bit more, they perhaps have heard you talking and discussing it with the other people, like, oh, what's going to happen, this is happening, that's happening, and for them it's perhaps a little bit harder for them to understand what exactly is going on. They perhaps cannot really process what's going on, and they probably have a lot of uncertainties and also worries on their own, right?
They don't have enough information also
for them to actually know exactly what it is that is going on, right?
And I think for me as well, if my parents are scared about something, definitely I'll be scared about it.
Yes, and it kind of they kind of pick up on your emotions.
Yes.
Yeah.
So
some of the changes to watch for.
Yes, is number one is excessive crying or irritability in younger kids. So usually you can see the changes, basically it's drastic changes. If suddenly they're okay, happy-go-lucky, and suddenly they become like irritable and cry a lot, that's one of the signs.
Yeah. Okay, so another thing is returning to behaviors they have outgrown. For example, toileting accidents or bedwetting. So if you do notice these things, then maybe something's going on.
Or maybe you can see them actually like worrying, or there's sadness, but you have no idea what's going on, or there's nothing to be sad about generally.
Right. Unhealthy eating or sleeping habits. Or acting out, right?
Actually,
just generally acting out, like they're usually normal and okay and
tantrum,
fine, and all of a sudden you see them acting out. They have tantrums, irritated, and things like that.
I think so. Those are some of the symptoms. You can go and Google some more or watch our other videos, but that's what generally you need to look for. So right now, Shah is going to share with us the first tip on how to support your child when you think they're having difficulties with this.
Okay, so number one would be take time to talk with your child or your teenager about the COVID-19 outbreak. What you need to do is to actually explain to them what's going on and why certain things are not allowed. And of course, they're going to have questions. Try to answer their questions as as proper as simple.
As possible.
Not to complicate matters.
Don't give them a long-winded answer. Just say it and that's it.
Just say it and that's it. And they have to understand that, okay, mommy's okay and daddy's okay as well, so I will be okay too. So that is about reassuring them as well, right? So
which comes to the second tip, which is reassuring your child or teen that they are safe. So of course, what you can tell them is, I know this is happening, but you need to know is don't worry, daddy and mommy already figured out what we need to do to stay safe and to stay healthy. So some of the things maybe you can help mommy and daddy is blah 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 blah. Maybe get them into the whole process as well. That will help give them some kind of control, right?
Yep. And it's also okay for them to know that it's okay for them to feel upset, right? Right?
Yeah.
Okay, so number 3 is limit your family's exposures to news coverage of the event, including social media. Once again, I would say children may misinterpret what they hear and they see, and they can be frightened about something that they do not understand. So generally, it would be good if you do limit it for them.
And then another thing is try to keep up with regular routines. If school, we don't have, we're not going to school, the kids are not going to school, create some kind of routine for your kids, like what time they eat, what time they do activities, what time they do arts and crafts, so that they kind of have that security of the day-to-day basis.
And lastly, be a role model. So once again, they pick up on your emotions, they pick up on what you do. So if you do something, then they're going to follow through on those routines too. So you take breaks, they take breaks. Get plenty of sleep, exercise, and eat well. So connect with your family and friends too. So if they see you doing and you are comfortable with what's going on, they will also adjust to it. Yeah.
So those are some of the tips. So I think what you can do is, if you think that this is overwhelming and you don't know how to help your children, what you can do is actually we have the services,
e-therapy services. What you can do is you can actually contact us for an appointment, and we will discuss the issues together and we could help you out.
Yeah.
All right.
Thank you.
Thank
Goodbye.
you. Bye.